Okay, so good afternoon, Miss Raven. I'm Tamaria. I will be your nurse for today, and I'll be doing your physical assessment part two. I might have to touch you during this exam. Is that okay?
Yes.
So first, I'm gonna listen for her apical pulse, which is mid-clavicular, fifth intercostal space down. Her pulse is 86. It's regular rhythm. I'm gonna listen to your carotid. Mm-hmm. Her carotid and her radial pulses are equal and symmetrical. Her upper and lower extremities, the temperature for them is equal bilaterally. I'm not noting any edema in her face, neck, or extremities bilaterally. And then I'm gonna watch you breathe, so just breathe in and out normally, like no deep breaths, just normal breathing, okay? Okay. You ready? Her um her respirations is 18. And now I'm gonna do her chest excursion, so send it for me. Turn this way. Deep breath in and out. Do it again. Okay, so front and back is symmetrical. I'm gonna listen to you. Have you had a cough recently? hasn't had a cough, so there wouldn't be like any sputum or anything. And then close one side of your nose and breathe in and out for me. And then go on the other side. So it doesn't sound like she's congested at all. For this next part, I'm gonna have you lay on the bed, and then I'm gonna listen to your abdominal area. So if you wanna go to the couch for me. Her bowel sounds are normal, active times 4. Her abdominal contour is flat. When's the last time you had a bowel movement?
Yesterday.
Was it runny or like firm?
Firm.
Was it dark brown, black, or like clay colored?
Like a light brown.
Light brown. And then did it have any blood in it?
No.
And do you have hemorrhoids at all? Okay, and she has no hemorrhoids. So then I'm gonna have you sit back in this chair.
Okay.
When's the last time you went to the bathroom?
Today.
And then was it dark yellow, light yellow, or straw colored?
Dark yellow.
Did it have an odor?
No.
About how many times a day do you go to the bathroom?
3.
Okay, so normal output is 1,200 to 1,500 milliliters a day. Anything less than 40, you need to notify your healthcare professional. And then I'm going to teach you how to do a self-breast exam, right?
Okay.
So what you do, you can sit down. So what you do, you'd stand in a mirror, and then you would like put your arms, like put your arms on your hips, and then when you raise your arms, you're looking for any like asymmetry or dimpling in your breast, but some asymmetry is normal, but the dimpling is not. The best time to do the self-breast exams is between days 4 and 7 of the menstrual cycle, or right after the menstrual cycle, or for men and menopausal women. It's best to time it with like a car payment or a truck payment. That way you do it at the same time every month. If you find anything abnormal, like a lumps or anything, then you would need to notify your healthcare professional, okay? And then same thing with like the test. Oh, so I have to show you how to do the breast exam. So you can do it in a circular motion where you start in the middle and you just work your way circularly, but you don't take your hand like off the breast or anything. You keep it on and you feel your way out. You can do it vertically where you just go in and out, or you can do the wedge, which is like this, but you still don't take your hand off the breast at all, okay? And then for a testicular exam, it's the same thing. You pretty much want to time it with like a car payment or a truck payment. That way you're doing it at the same time every month. You would take your 2 forefingers and your thumb, and you would palpate the area on the testes, behind the testes where the epididymis is. It's like a coil behind the testes, and you're looking for any lumps, masses, pain, and anything abnormal. You would want to report back to your healthcare provider. You understand? And that is all. So let me see what I forgot. Do you have any nausea or vomiting? Have you had any nausea or vomiting within the last couple of days?
Nausea.
Okay. She didn't have an ostomy. She didn't have the appearance and patency of the anus. So she had a bowel movement yesterday, so her anus should be tight, and it should be tight, it should be darker pigmented, and I think that's it. And then she didn't have the ostomy for the genitourology, urinary.